thank you all for being here this afternoon. And thank you for complying with the social distancing requirements. And I see that you all have your masks on. That's terrific. I'm glad to see that. Here with me today is Dr. Fred Eccles, the city's Director of the city's Health Department, and Judge Jimmy Edwards, Director of the city's Public Safety Department. I want to address just a few quick things before I turn this over to Dr. Eccles. Has some new data, some new information for you. First of all, today is exactly 30 days from the date that the city received its first case of positive COVID-19. And at that time, our emergency response team has worked really hard under tremendous circumstances to take decisive and unprecedented action. And we know that all of our residents and all of our businesses and all of you have been working very hard as well to try to inform all of our constituents. As you know, we placed a social distancing restriction in place. We limited bars and restaurants to carry out or take out only. We've limited the size of any gathering to 10 people. And on March 23rd, we issued the first mandatory stay-at-home order. And I recognize that these decisions and orders have been very disruptive for folks, inconvenient for folks, and frankly, downright devastating for businesses and for our workers. So I want to thank everyone. Everyone has played a part in where we are today, and all of your sacrifices are very much appreciated. Yesterday, you may have heard from Dr. Alex Garza. He is the incident commander for the St. Louis Metropolitan Pandemic Task Force, that our early preventative actions are helping. There is evidence in the St. Louis region that we're making progress, that we're bending the curve a bit, and hopefully we'll soon hit the peak. But we're still a ways away from being able to say that we have flattened the curve, hit the peak, and are going down the other side of that curve. So after consulting with local healthcare experts, the heads of BJC, SSM, Mercy, and of course with Dr. Eccles and his counterparts, public health officials in both St. Louis County and St. Charles County, we have decided to extend the stay-at-home order. This remains a very fluid situation, so we're not setting an end date, but we are saying to you that within a few weeks, at least by mid-May, we hope to be able to reevaluate this situation. We've only had the stay-at-home order in place now for a little over 3 weeks. And in that period of time, think about all the things that have happened, how much new information has come about. So we hope that in the next 2 to 3 weeks, we similarly have more information to be able to make a decision about being able to lift that order. Lastly, before I introduce Dr. Eccles, who you all know by now, I want to emphasize that the new order is largely an extension of the previous order, but it does have a couple of new things in it. One, new recommendations. One, recommending that everyone wear a mask when they're out in public. Thank you all for doing that. And also requiring that essential businesses that are allowed to remain open are also required to provide PPE, the appropriate PPE for their employees. So that's masks, gloves, depends on what the actual business is. But that is something that was not in the first order, but we think is an important component of this. So before I turn this over to Dr. Eccles to provide you with some new information, I want to just say that we are, our St. Louis Development Corporation, along with Linda Martinez, Deputy Mayor for Development, we are beginning to think about what will it look like, how will businesses be able to be turned back on. And that is a very fluid situation, but I just want everybody to know that we are thinking about that because we know that you are also thinking about that. So we'll have more to say about that in the future weeks, but it is important for all of us right now to stay the course, to continue to stay at home as much as possible. We know that many of you are working. All of the photographers and the reporters who are here today are working. We know that our police and our fire and our corrections officer, our dispatchers, they are all working. The people who run our water department, they are working. The people who are picking up your trash, they are working. So we know that not everyone can stay at home because they do provide essential services. However, what we want to say to those of you who can work from home, you must continue to try to work from home. And please follow the social distancing recommendations for a few more weeks. Thank you all. I want to turn this over to Dr. Eccles, and I'll be back with you for questions. Thank you so much. Dr. Eccles.
Thank you, Mayor. As the Mayor mentioned, 30 days ago, the City of St. Louis saw its first positive case of COVID-19. As of this morning, 762 cases have been reported to the City of St. Louis Department of Health. Our city also sends our sympathies at this time to the many families who have lost loved ones due to the virus. To control the spread of COVID-19, I've issued 6 executive orders to limit close contact, as well as implement other community mitigation strategies necessary to slow the spread of COVID-19 in the City of St. Louis. Many of our neighbors, businesses, and individuals have aided by these orders, have abided by these orders, doing their part to slow the spread. Unfortunately, we still have some individuals in our communities that are not abiding by the order that was previously issued, and we take this opportunity to really encourage them to implement social distancing, meaning that they stay at least 6 feet away from others to minimize their potential for being exposed to COVID-19, as well as if they are infected with COVID-19, it limits their ability to actually transmit the virus to others. These strategies are really important, again, to slow the spread of COVID-19 in our jurisdiction. Over the last 3 weeks, we've been monitoring the number of cases that have been coming in, as well as looking at which populations have been impacted. As we all know, the first reported 13 deaths associated with COVID-19 were all African American. Of these 762 cases that have been reported, over 70% are African American and individuals that live in areas with high poverty. These statistics are not new. If we look at the data going back 10 years, 20 years, even 30 years in our region and across the nation, certain populations continue to be adversely impacted and share the brunt of communicable diseases such as influenza, sexually transmitted infections, chronic diseases such as asthma, diabetes, hypertension, and now COVID-19. So the plight is not new, but our strategies have to be. So the City of St. Louis Department of Health, along with support from the Mayor's Office and other city government agencies, are working hard to ensure that this course changes for the City of St. Louis. We're using evidence-informed approaches to engage traditional and non-traditional partners, bringing them to the table in a way that has not been done before, giving them a call of action so that they too can assist with lifting this work. It's taken us decades and centuries to get where we are, and so the change cannot happen overnight. Although we know change cannot happen overnight, we have to be consistent, intentional, and strategic in our approach to addressing these systemic issues that have led us to where we are. We take our roles very seriously, not just during the time for COVID-19, but COVID-19 and beyond, to make sure we're properly serving the community that we're charged to serve. Failure to do so would be an injustice. and that is against our mission. So to create an equitable healthcare system in the city of St. Louis and for the St. Louis region is not only part of the city of St. Louis Department of Health's mission, but it's also a mission component of the city of St. Louis County Department of Public Health, St. Charles County Department of Public Health, and the health systems that we're working really closely with. A lot of businesses have been impacted by COVID-19 as well, and the city of St. Louis is not exempt. For the city of St. Louis, we've had 31 city of St. Louis employees test positive for COVID-19. These exposures, most of which occurred in the community due to community spread, also impacted our workforce. However, due to infection control practices that have been implemented across city agencies, we've been able to minimize the number of individuals in our workforce that have been impacted. We continue to implement these strategies to make sure that essential services necessary for the city of St. Louis can continue to be performed every day. In addition to making sure our staff are protected, we're also working closely with federally qualified health centers who have really helped us increase testing access across the city of St. Louis. In particular, Affinia Healthcare, led by Dr. Alan Freeman and his team, have stood up 2 sites in the city of St. Louis, one at 1717 Biddle, and the other site located at 6367 Page in Pagedale. Each day they see roughly 40 to 45 patients at each site, meaning that there is a need for testing in these areas. In addition to Affinia, we've also been working with Care STL Health, who currently has a site at 5471 Martin Luther King Jr. Drive. Like Affinia Healthcare, Care STL Health has also been serving roughly 40 to 50 patients per day. Again, speaking to the need for access to free COVID-19 testing in our community. Betty Jean Kerr People's Health Center is also coming to the plate under the leadership of Mr. Dwayne Butler. And on tomorrow morning at 9 o'clock a.m. at 11642 West Florissant, they'll be standing up their first mobile testing site, offering free COVID-19 testing to the community at large. Testing is really important. It allows us to understand which populations are being impacted in our community, but it also helps us pave the way forward. As we implement data-driven processes, it's critical that we ensure the resources that we are receiving from the federal government, as well as through those that are procured through the Supply Commissioner's office, are well utilized in our community. We continue to use data to drive our response for COVID-19. As we move forward, looking long-term, 6 months, 9 months down the line, we have to be careful about how we lift certain mitigation strategies. Lifting these strategies too soon can lead to a resurgence of cases, meaning that we'll be backtracking. We'll see an increased number of cases, increased number of deaths associated with COVID-19 if we do that too soon. So we have to implement a scientific approach to lifting these strategies. As the mayor mentioned, we understand that there is a significant economic impact. But at the heart of what we do, we're charged to serve, to save lives. And so as we move forward, we'll continue to evaluate the situation on a daily basis. We'll continue to communicate our findings to the community so that the community can understand what we're seeing and why we're making certain decisions. We're grateful for all of the partners that have come to the table to this point, because we understand that as a government and as the health department, we cannot do it alone. This is a community-wide response. And by engaging the community and charging the community to do their part, that's the only way we can get through this successfully. We're grateful for those that have adhered to the recommendations that have been issued, and we look forward to working closely again with our partners to get through this. Thank you.
Questions from anyone?
Is there any update on the number of people who died in
There is. 27. 27 individuals have died in the city of St. Louis.
Some of the protests in different cities, I know there's a couple planned for next week in other parts of this area. How worried are you about that happening here in St. Louis City?
We're always concerned about bringing folks along. We are only as successful as we are so far because we've been able to bring the people of our region along with us. We've been able to explain to them why they need to stay home, why they can't go out and eat in restaurants, why schools have to be closed. So the extension of this order and the continual reevaluation of this order and the continual communication, I think is so important. We've got to bring the public with us. And I think that really is the key. Many of you know I'm on Facebook Live 3 times a week. We are doing press conferences. We are on social media. We are doing everything that we can to get the information out to people. We know that not everybody's on social media. Not everybody watches TV. Not everybody listens to the radio. But that's why in conjunction with the Missouri Foundation for Health, the Prepare SDL is actually doing flyers in neighborhoods, particularly high-risk neighborhoods, in really just to get the word out. That is the most important thing. And so if we do a good job of communicating that, of persuading folks that it's really necessary for them to stay at home, that staying at home what has caused this not to be as bad as we feared that it might be, then I think the public will come along with us.
If that doesn't happen, are you at all in talks with the police department about strategies to handle that situation?
We have not had those conversations at this point.
Mayor, I interviewed a hairdresser before I worked with you, or I guess I should say a stylist, a professional.
Right.
She's a woman, she's got a family, it's her full-time job, it's not a part-time hobby thing. Your extension, even though you didn't put a lid on it, you said you'll revisit it hopefully by mid-May.
Well, we will revisit it by mid-May, but we'll continue to revisit it every day, every other day. So.
Could it go to mid-May? That would take it
Correct.
7 weeks.
Correct.
She can't survive. There's just no way. Is there any thought to extending what's considered essential? Because she has her own salon. She controls how many people are in there and sanitize it better than she does. That's what she said. You know, I can do it better than any grocery store. Be way safer than the businesses that are allowed to stay open.
But she's
I can
touching.
stay open just as much as they
She's touching people all day, every day. That's a very personal
Only wear
experience.
gloves and masks and you know.
That's a very personal experience. You're very close to your hairdresser. I need my hairdresser right now. Thank you very much.
I mean,
And it's just.
Have you looked at other occupations that maybe you could extend the umbrella a little bit beyond reporters, photographers, you know? People need
You
to work,
can't
they can-
social, I'll let Dr. Eccles take this question, but the short answer is you can't socially distance when you're doing someone's hair. So, do you have more you want to add? Great.
So as we said before, we understand that this has a significant economic impact. However, at the heart of what we're doing, our charge is to save lives during this epidemic. Our failure to save lives in our jurisdiction puts us in a much worse place than we would be otherwise. And so we have to adhere to these strategies, as difficult as it is, in order for us to get through this.
They say they're going, you know, if you take it out that far, they will go out of business. Those gyms just closed all St. Louis locations, not indefinitely. They're out of business because they can't sustain it without being open. And that's, you know, she said today, mid-May, I probably have to figure out something else to do.
Right. And so. Right. She can apply for unemployment and also federal assistance through the CARES Act. But again, the intent of the order is to save lives. As I tell individuals, if people are dead, there's no economic recovery.
You say it's data-driven. Are you following data on other illnesses? Like 762 out of 315,000 people how does that compare to other illnesses over the last 30 days? Is this the leading cause of illness or death or anywhere close in St. Louis?
So the most comparable illness will be influenza. Unfortunately, influenza, single cases of influenza is not reportable to the Centers for Disease Control and Prevention. So we only track outbreaks and clusters that are identified in our jurisdiction. So years ago, that reporting change was made because of the burden of reporting that it put on local health departments because they didn't have the capacity to actually do it during the season. So they limited to only clusters and outbreaks associated with influenza, but that's the closest condition that's reportable at this time.
Is this an unprecedented, illness situation, numbers wise, by the data? Has St. Louis ever seen something that's caused so much sick, is this, like I said, the leading cause of illness in the city? Or you even know?
Well, at this point in time, but there are also other factors that we have to take into consideration. So individuals may have underlying medical conditions, et cetera, that may impact their ability to actually provide a sufficient immune response. And so we have to take all those things into consideration. But unlike influenza and some of the other vaccine preventable diseases, there are pharmaceutical interventions, vaccines that are available to help protect individuals during influenza season or during certain months of the year. So we don't have any pharmaceutical interventions available for COVID-19 yet. There are some clinical trials that are being implemented, but it may be 18 to 24 months before something is actually available. And so the best thing that we have in our arsenal now to actually protect ourselves is our behavior. So making sure we adhere to social distancing recommendations, staying home if you're ill, washing your hands regularly with soap and water, using hand sanitizer if soap and water are not available, covering your mouth when you cough and sneeze. Those simple behavior changes can help protect individuals from COVID-19. So that's why because that's what we have available to us now, that's what we continue to emphasize. As pharmaceutical interventions get online and become available to the general population, at that time we can recommend those depending on what the evidence shows. But right now we don't have that as a tool that we can use.
I know that I think a lot of people are feeling anxious for a lot of reasons, but one of them being that it feels like this is just never going to end, that we don't have a specific date. So can you give us an insight into why you're not pinpointing a specific day that, say May 15th we will reevaluate? Why just say mid-May? Why just extend this indefinitely?
Well, we will reevaluate on or before May 15th. That's firm. St. Charles, their order is an indefinite order. When we put our order in place for 30 days, that seemed like a pretty safe period of time. But right now, should it be extended for 1 week? Should it be extended for 2 weeks, 3 weeks? So we're just not putting an end date on it, but we are committing to reevaluating this continually, and we will be back to you at least by May the 15th.
Mary, you mentioned you've already started to think about what this looks like, when we do come back.
Right. The whole country is thinking about that.
I know. Do you have any ideas or any insight you can share with us now and the citizens now? I assume it's not going to be flip the switch and everybody's back.
I don't believe it's flip a switch. I'm probably reading a lot of the same things that you are and working with people in my team to figure out, and business leaders to figure out how can we come back from this. So is it first that all outdoor jobs come back? Maybe. I'm telling you, I'm just spitballing this with you. All outdoor jobs come back. Then maybe part of the office jobs come back. And then, maybe at some point you're able to go to a restaurant, but perhaps there's some more rules in place, spacing, maybe gloves. I don't know. All those things are things being considered. None of us have ever been through this before, and it is frustrating, and it does make us all anxious, and we like certainty. We really don't like this unknown, and I wish I could tell you exactly when this would be over, but we can't. And we are working every day to figure out how to bring businesses and economies back when we can do that. But what we don't want to do is do a good 3 weeks, a little over 3 weeks now, and staying at home, right? That's been hard on everybody. And we don't want to lift this too soon and have a big spike in the number of cases, in the number of people who are in hospitals and in ICU and on ventilators. And we also don't want to have another wave, because you are seeing that in some countries. And so everybody is learning on this. I will tell you, when I was sworn in as mayor, which will be 3 years ago tomorrow, I never in my wildest dreams imagined that we would be dealing with a pandemic. And I think everybody that you ask would say that. And so we're all learning, we're all doing the best we can to try to keep people from getting sick and from infecting other people, and to be able to bring our economy back. So.
You were mentioning you were taking some traditional and non-traditional approaches to address the issue where the African American community is the hardest hit right now.
Mhm.
So can you give us specifics on what you're doing to help with that situation?
On the communication front, I think I mentioned that we are flyering neighborhoods. We are using pastors, the clergy, to try to get the message out. We are using influencers in various neighborhoods to try to get the message out. So all of those things are what we're trying to do to communicate for folks to stay home. But this inequity in the healthcare industry didn't start with COVID-19. It started decades ago, and it is exacerbated by a situation like this. So.
Thanks, guys.
Thank you all. Thank you.